Okay, so good morning and welcome to Healthy at Home. Today is a continuation of the pelvis, and we're going to be diving deep into the sacroiliac joint, also known as the SI joint, as well as bowel dysfunction, and then some tips for that. There's a lot to talk about today, so instead of trying to cram in the exercises too, I'm just going to save time for thoroughly explaining it and then giving time for questions, because the things I'm going to chat about specifically for bowel aren't always discussed. So I'm going to share the screen. Okay, and let me just start the PowerPoint now. Nope, that's not what I want. Okay, so the beginning slides, Barry, for you, it'll just be a review, and then we'll get into some new slides. So today is Healthy at Home, the pelvis. This, again, is just an educational virtual video chat. It is not to be used in exchange for skilled PT. If you need one-on-one care, that is the email address that you can reach us at, and that phone number you can also text at. You can schedule an appointment with myself or one of my virtual teammates who are PTs as well. So the pelvis. We started with this one last time because I love this image because it really just shows you how the pelvis kind of intersects here. Not kind of, it does intersect with your sacrum, closely related to your lumbar spine, and then the hip joint. Last week we spent exclusively speaking about the hip joint, and so there is quite a bit of connections the pelvis has. That is why whenever someone has pelvic floor dysfunction or is complaining of SI joint pain or lumbar pain, hip pain, any of those things, because of the connections between one another, you have to consider all the other areas as well. So just a few important parts. The sacroiliac joint is right here. I will be showing you on my model, my pelvic model later, just a close-up so you can really see. But the sacrum itself is 5 fused segments. So when we were developing, they were individual, but then in our neonatal development, they fused, and it created these 5 fused segments. So the sacrum connects with the ilium, which is one of the bones that make up your pelvic half. And there are 3 main bones that make up each pelvic half: the ilium, the ischium, and then the pubic area. So we medically consider each half of the pelvis one nominant, just an aside. But the sacrum connects with the ilium right here. You can see that line on either side. Good morning, Jeannie. And so you can see the line, and that is your sacroiliac joint. So on an organ standpoint, the pelvis is a basin that holds all of the organs. So in a woman, you would have the uterus, the ovaries, fallopian tubes, and then in men and women, you'll have the bladder, rectum, end of the sigmoid colon, and it just holds all those organs in place. Now, on the next slide, you can appreciate how much ligamentous structure there is around the pelvic lumbosacral area. These ligaments are super important for stability. To make it personal, I sprained one of my lumbosacral ligaments on the left side when I was trying to do aerial Cirque du Soleil kind of performance stuff. And this lumbosacral ligament was actually up here. You can't see it from this view, but it connected down into the crest of that back part of the pelvis. And it referred, when I had the pain, it referred just like it did for some common back problems through my sacrum and then into my lumbar spine. Our body is covered by fascia. I'll be diving deep into fascia in a few weeks with one of my guests on my Be Well Live series, but fascia is connective tissue that connects our whole body. So if you were to sprain one of these ligaments, or you could feel the referrals of those symptoms throughout the whole general region just because of the connective tissue that surrounds that area. Another important part I just want to say is because there is so much ligamentous stability that the sacrum needs and the SI joint needs, if at any point there is, a strain or some kind of trauma that happens to the pelvis, say car accident, say fall, there will be a instability there that you have to make up for with muscular stability. Yes, and so then the other point I wanted to make is that you can see the curvature here of this sacrum, and then at the very bottom is the coccyx. That's technically our tailbone. Everyone's curvature is a little different. No one's anatomy is exactly the same. There really is no true normal. Everyone's a little bit different. So depending on the curvature of the sacrum, this could impact certain movements, aggravating your SI joint. Okay, so I'm going to go on to the next slide. So this was a nice slide that showed us our pelvic floor muscles. This is, again, a side view. They cut through someone like in half, so you're seeing one half of the pelvis. And you can see this is a female pelvis because there are 3 orifices. And however, in both men and women, it's the same pelvic musculature. Some of the names are just different because of the different insertions and origin. But you can see here that there's a pelvic wall musculature and then the pelvic floor musculature. These muscles help with urinary function, sexual function, bowel, and then just in general core strength. Remember, we spoke about in previous Healthy at Homes that there's 4 muscles that make up our core. We have our diaphragm, transverse abdominis, lumbar multifidi, and pelvic floor. Those are the 4 main ones. Some researchers will say that some of the erector spinae comes into play too, which it definitely does, but those are the 4 main ones. So next, this is just a top-down view. Again, this is a female pelvis, and you can see here just the musculature. This is important for bowel, bladder health, to be able to have this functioning properly. I'm going to just point out the puborectalis muscle, because when I speak about bowel and constipation a little bit later, this muscle is an important muscle for allowing us to properly pass our bowels. And if there is a mechanical dysfunction or muscular spasm, for whatever reason, the stools won't be able to pass fully. And then from this view, you don't really have a good view of the SI joint. So I'm going to move on. Okay, so this is just another organ view. We went over this one last time. In terms of constipation, I can point out here that this is the end of our sigmoid colon, which is the end of our intestines, which then becomes our rectum. So this is where the stools will be passing through. Again, this is a female pelvis because you can see the uterus and the ovaries. And then you see the bladder over here. Our pubic bone is the main shield for our bladder, actually. So moving on. Okay, great. So this is a back view of all of those ligaments that help stabilize your sacrum to the ilium. You can see there's a whole lot of ligaments. There's even ligaments that run directly on the spinous process of your vertebra. And it connects all the way up. Everything's connected from head to toe. There's that connective tissue. So if at any point you have sprained one of your lumbosacral ligaments, that will lead to a little bit of instability. Now, the instability, like I said, if you have instability, you want to be doing strengthening exercises like core exercises, hip strengthening, glute strengthening, all of that stuff to help stabilize. Everyone's body is a little different, so depending on what each person can tolerate will differ, but alas, it's the same kind of thing. If someone's unstable, you want to help stabilize by doing strengthening. I want to point out too the front view, which you can see down here at the bottom, the ALL, anterior longitudinal ligament. You can see how thick that ligament is in the front. That just helps prevent anterior forward translation of the spinous processes and the discs. And then I like this image because you can see the inside of the pelvic ligaments, which you don't always get to see. And you see it's thick. It's very thick, these ligaments, to stabilize and keep the connection of the pelvis with the sacrum. So next, this image might be a little confusing, but I'm just going to point out that they're showing here, this is from Machado. I normally use all Netter, but this is Machado, another anatomist. They're pointing at the piriformis muscle and the proximity of the sciatic nerve. In every person, the sciatic nerve course can be different. Most people, it goes underneath the muscle. Some people, the sciatic nerve goes above the piriformis. And then some people, the sciatic nerve actually pierces through the piriformis muscle. There's no way for us to know that from the outside. Yeah, isn't that crazy? So there's no way for us to know that from the outside. You would have to have like an ultrasound or an MRI to know if you are one of the small percentages who has the nerve that goes through. Yeah, I've seen it in cadaver lab dissections, and it actually does happen. So they're showing some of the referral patterns too, if someone has sciatica based, typically caused by piriformis syndrome. So you can have the symptoms going down the leg, you can have some of the symptoms here, and then on the outside of the calf. In this bottom left, they're showing a woman that's carrying a child. SI joint dysfunction is so common when women are pregnant because of the increased laxity that's happening in their body. Remember, the sacrum is literally, the SI joint is, or the sacrum itself is held together onto the pelvis. I'm going to rephrase that. The pelvis is connected to the sacrum via all of those ligaments. All of those ligaments keep the pelvis connected to the sacrum. Without that connection, the pelvis would literally fall away from the sacrum itself. So when there is that increased laxity in the body because of pregnancy and all the hormones, the SI joint is one of the first places where women will experience instability when they're pregnant. I also mentioned on Monday that the pubic symphysis is another part too because of that separation. I like this top view down here at the bottom because you can see the sacroiliac joint in another way. You see the sacrum connecting into the ilium. And so that's just a view of that. Okay, then, all right, so I kind of touched on this already. Sacroiliac dysfunction, when a physical therapist and a physician are treating it, they're looking at it from a standpoint of, okay, does this person have hypermobility, meaning do they have too much movement? Do they have hypomobility, meaning not enough movement? Or is there lumbar spine involvement? So the treatment is determined by what is the root cause. So many times people will have referral into the Fortin's area, we call it, which is just a referral for potential sacroiliac joint dysfunction. But it may be coming from the lumbar spine. It may be coming from a disc herniation. It might be coming from the spondylosis, which is that stress fracture degeneration that can happen at one of the lower segments in the lumbar spine. Or it could be a matter of it being too tight. You could have really tight musculature in the gluteal hip area, and it's not allowing for enough mobility, and that's causing pain. Or you can have very loose ligaments. Maybe you had some kind of trauma, like myself. Maybe you sprained a ligament and your muscular system isn't keeping everything together and stabilizing. So there's many options. Determining what each person is, where each person's symptoms fall takes some time. But with tracking symptoms, you typically are able to figure out what is the cause. I should also say that when I'm treating SI joint dysfunction, if I know someone is a runner, I always tell them to stop running for at least 2 weeks to allow for it to calm down. If I know someone likes to do like lunges and plyometrics where they're jumping up and down, that like singular one-legged motion where you're like jumping from one leg to another typically will irritate SI joint dysfunction. Also, some common tips. You want to sit when you're sitting with your feet flat on the ground. Most times I have to give this modification to women. You don't want to cross your legs if you're having SI joint dysfunction, because that can actually irritate the SI joint. So then sleeping too, if you're a side sleeper, you want to put the pillow in between your knees. Many people do this. They figure it out intuitively. If they're having that problem, they'll put the pillow in between their legs, and it will help to balance out the pelvis and avoid irritation in the SI joint. So those are some of the main things that I would recommend for modifications if it truly is SI joint dysfunction, regardless of the cause. If it's lumbar, hyper, is to hold off on running. Obviously, you want to be seeing a physical therapist. You want to also hold off on any plyometrics where you're jumping and switching legs quickly, and then be aware of if you're sitting with your legs crossed and your bed positioning. So those are some really simple things that make a big difference in how someone is feeling. I'm going to just, or improving their symptoms, should I say. I'm going to stop my screen share so I can show you my pelvic model. And I just want to add, so this is my pelvic model. I showed you guys at the end last time. I'm just going to reattach some of the ligaments because they came off. Give me a second. Okay, there we go. Good. It's all connected via magnets. It's pretty cool. So, and I've already removed, this is a female pelvis, by the way, but everyone's joints are the same more or less. So you can see here, you can see this is the sacrum, the 5 fused segments, and then you can see the coccyx, that's that little triangular pointy part. And then you can see the pelvic floor muscles are in there still. That's the red is the muscles. The sacroiliac joint, we have the sacrum here, and then the ilium here, and then they form where 2 bones meet is a joint. So sacroiliac joint. Now, the sacroiliac joint is there to transfer the forces through your legs and the pelvis. So whenever you're walking, you're standing, it's there to just help with the transference of the forces and the stresses. There is a very small amount of movement that happens there, but it's super small just to accommodate for the movement of your legs. So where the sacrum, this bone, this 5-portion bone meets the ilium is the sacroiliac joint. If you look at it from behind, it's harder to see here. I kind of tilted it down though. So all around here is considered the sacroiliac joint. I'm going to take this ligament off so you can see. If only this was so. This is the back of your sacrum, and this is your ilium. So where they're meeting here, all the way around, is your sacroiliac joint. And then so sacroiliac joint here. So what else did I want to show about this? Oh, I wanted to point out the lumbar spine involvement. So you can see that this is L4, this is L5. These are the last 2 segments of your lumbar spine. You see the discs that are there. So if you were to have a disc herniation, which the most common form of disc herniation is posterior lateral, very few people end up with a disc herniation going forward. If it were to be posterior lateral, so it would be like where my finger is right here, like sticking out that way. That's an exaggeration. It wouldn't go that far, but in that direction, you would get a referral of the symptoms in this area too. So that's something to take into account. Again, remember when we're trying to figure out SI joint dysfunction, is it the lumbar spine? Is it the actual joint? And if it's the joint, is it hypermobile or hypo? The other thing that I had mentioned was spondylosis or spondylolisthesis. It could be that too, but more commonly spondylosis, which spondylosis, let me see if I can show you. So spondylosis, I'm trying to angle. Yeah, okay. So spondylosis would occur right here if you look, this is that Scotty dog area, remember I spoke about? So if you think of this like a little, I forget what kind of dog that is, but if there was a collar right here, and this is the head of the dog, this is where the arthritic area would be. And in spondylosis, that can commonly refer into the SI joint, Fortin's area as well. So, yes. Any questions about SI joint before I finish off with bowel tips?
The parts that you were able to magnetically remove in your wonderful model, what bony processes are those?
Oh, so what are they attaching onto, you mean?
Well, what are they?
So, yeah, so this is your ischial tuberosity, also
Okay.
known as your sit bone. So that's your sit bone.
Oh.
And then this is, I forget what they call this exact spot of the sacrum, but of the ilium. This is still the.
It's still part of the ilium.
It's still part of the pelvis itself.
Right.
So it's running literally from the top all the way down to the bottom. Although, you know, now that I'm looking at that, I think they did the magnetic part incorrect. Yeah, so, okay, so this is one of the things. So it runs from the sacrum, the back of the sacrum, to the ilium, all the way down to the ischium. So the ischium, the ischial tuberosity, aka your sit bone. So it's like a triangular kind of ligament.
Mm-hmm.
And they made this one big ligament, but it's actually multiple fibers that make up this area. Did that help?
Yes.
Okay. Barry, any questions?
No, it was very detailed. Thank you.
Okay. Yeah, I wanted to take the time to just break it down some more. Okay, so I'm going to finish with showing the slides about bowel tips. So we're going to put the pelvic model off to the side now. And I'm going to share the screen. Oh, here it is. No, this is what I want to share. Okay. And let me just pull this back up. All right, so remember we pointed out the puborectalis. So when we are sitting on the toilet and you're trying to have a bowel movement, it is most ideal to be sitting with an erect, straight spine. That doesn't mean that you're sitting all the way up, just means that your spine is straight and that you're not rounding and slumping. Because what happens when you round and slump, you tuck your pelvis under, and then the puborectalis will constrict on the rectum and not allow for the stools to pass. So as you can see, so as you can see in the gentleman to the right, he's keeping a straight spine, and the puborectalis allows for all of the pelvic floor musculature to descend and allows the rectum to pass the stool. Because if you think of it, when this person's tucked under over here, the muscles are slightly contracting. So in order to allow for the bowel movement to happen, you want to have more relaxation in the pelvic floor area than tightening, because the relaxation will allow for it to pass. Some other tips about bowel habits is you want to keep breathing. Many people will hold their breath, especially if they struggle with constipation, to like bear down, but you want to let the air out. This is also really important to prevent hemorrhoids and straining. So one of the exhales that I teach my patients to try to play around with is to do the shh exhale. This will help. That helps a lot of people. However, some people find benefit with the s or just any variation in between. But shh, I've seen a little bit more success with that one. In general, though, if you're breathing, you're probably good. So next image. So they show having your feet elevated. This is an option. I don't personally recommend the squatty potty. I think you should be resting on the toilet. But what they're showing here is they're bringing your feet up so that the hips are in a little bit more flexion, and then it just allows you to shift your weight, your forearms forward onto your thighs. So that just allows you to relax, also keep the spine straight, and then relax the pelvic floor. Now, you don't necessarily need the footrest. It depends on the toilet. You could just lean forward and put your forearms directly on your thighs. Okay, so we already went over pelvic floor dysfunction last time. Today was mainly about SI joint dysfunction and constipation. So, and we've spoken previously about pelvic PT treatment. We're not going to do any exercises today. So next week will be the last week of Healthy at Home. Next week is the start of my live stream series that I'm doing on Instagram and YouTube. So if you have an Instagram, follow Inspira Physical Therapy. I'll be bringing on different doctors. I'll be bringing on a pelvic pain doctor actually in the second week. Next week, I'm bringing on Blossom Leilani Crawford to speak about the evolution of Pilates. And then Dr. Shaw Bronner, who is the physical therapy director at Alvin Ailey. So we'll be speaking about safe return to dance after quarantine, or even now safe dance habits now. We are continuing our virtual Pilates classes. My beginner class has 1 spot still, so if you're interested, let us know. And then the intermediate class is more challenging, so there's a few more spots that are open for that class. That intermediate class is Wednesdays at 6. And then I have my team of PTs who are treating patients as well. I am seeing patients also virtually. I've mentioned this webinar. If you want to learn more about disc herniations and scoliosis, it's very detailed and it's educational. So you can email us or sign up online. And then this is just the schedule of the guests who will be on my live stream series that starts next Tuesday. I should also mention that if you, I keep forgetting to say this, if you are there viewing the live stream on Instagram or YouTube and you comment a thumbs up and you're one of the first 5 people who do, you get a Pilates class voucher. So you get to take a Pilates class for free. So yeah, that is a little incentive. And thank you for you guys for participating and tuning in. Here's the contact info. That's the Instagram name, and the Facebook and YouTube business name is there. And that is it.
So are you doing Monday, even though it's Memorial Day, or is it just next Friday?
I am doing Monday. Yeah, I didn't even know it was a holiday.
Yeah, I know it doesn't feel like a holiday,
It
but
doesn't feel like a holiday.
Nothing feels separated.
Yes. So
Nothing feels differentiated.
I will be here Monday next week in Healthy at Home. We're speaking about the foot and the ankle.
oh, great. Okay, thank you very much.
You are welcome.
Have a great
Okay.
weekend.
Guys, stay safe, stay healthy, and I'll see you next week.
Thank you. Bye-bye.
Great.
Bye.
Bye.